Hi, this is Dr. Shivkumar Anand reporting from New York, CJI, Consulate General of India. So all the way we came, Wheels for Foundation. Today we discussed like 2 hours from India all over the world, conference calls. And here I have with me Ratan Agrawal, CJI office. So tell me about the Wheels. Yeah, what's your name, sir? What's your name, sir?
Vinay Pradhan.
Vinay Pradhan here. So tell about Wheels of on Foundation. So what is your goal, CGI? What's your goals throughout the world? It's a big organization. Intellectual peoples are there. So what's your goal? What you did so far, and what is your future plans?
Okay, so my name is Vinay Pradhan. I'm Consul General of India in the city of New York. Today we hosted the event where Wills Global Foundation launched an initiative to provide technology-enabled solutions for taking care of malnourishment in Indian urban areas, primarily rural and remote areas. Good thing is that Wills Global Foundation has been working, since last 17, 18 years. And they have been working with the state governments, they have been working with the rural communities in India, and they are making real big differences there. While the government of India, the state governments are doing their bit, and they have big programs on all these sectors, but still there remains a gap, because of huge population that we have, and at times the technology aspect remains unattended on some cases. So I'm really happy that the Consul General of India could partner Wills in a very small way. We are just host of the event today, but they are doing the real commendable work. Both in terms of mobilizing the IIT alumni, getting support, not only the financial support but the time, and working back home with India, with the district authorities, with the national health missions, with the societies, communities, to tackle the challenges which are otherwise unattended. So I'm really happy that this initiative is being taken, and I'm sure going forward, as I understood from the organizers and from President Mr. Ratan Lal Agrawal, that they are going to take it to other states of India. So I'm really happy that the Consul General of India could be a very small part of this big initiative. Thank you.
Sure, sir. Any organization they need a finance, right? So where you are getting finance, and anywhere like Indian government is supporting for the finance purposes.
As Ambassador Pradhan pointed out, in large scale initiatives, when we are planning to touch millions of lives, you cannot do it alone. Not private entity, not public entities. And this is the example of perfect partnership where we have partnered with the MP government, and we have partnered with number of private entities like Wrist Foundation, which has provided the financing part of it here, as well as the technologies from entity like Cudewell, where the data analytics, decision-making intelligence is critical. So to do these large-scale initiatives, not only we have to tap into the partners who can provide funding resources, but also we have to have a business model whereby we can leverage much 100 times, 1,000 times multiplier sources of funding from the government structure itself. Often government has funding, but it is not mobilized correctly. And if we bring the right business model, right partnership, then we can tap into that funding. In Himachal Pradesh, we created a multiplier effect of 1 to 1,000. In MP, all the field implementation is happening through the ASHA workers, Anganwadi workers, nurses, and that is the real workforce which is deploying the change. So the resources, both public and private, are critical, and that is how we hope to work on all the initiatives.
Right now, how many members are there in the Wilson Foundation?
So Wheels Foundation has been supported by, I would say, about 50 dedicated members, but also extended members, about 200 to 250. And that will continue to grow as we take the message to our rank and file, holding the events in many cities and hold the webinars and sessions like these.
Thank you, sir. Nice to talk with you.
Thank you.
And
Thanks for your support.
thank you, sir. This is Dr. Shivkumar Anand reporting from CGI, Consulate General of India, Wheels on the Foundation. They conducted a very meeting from all over the world. Thank you very much. Hello, this is Dr. Shokmar Anand, JSW and Jai Swaraajya TV, Global Director. I am in New York, CJI, Consulate General of India. Here, Akshay Patra, you are the president and stuff,
No,
right?
I am representing Akshay Patra. I work
Okay.
as the development lead for.
Yeah, tell about your name and what's your role on Wheels on the Foundation.
Okay. So my name is Rishabh. I work as the development lead for corporate outreach and young professional initiative at Akshay Patra Foundation USA, and we were just invited here as one of the partners of Wheels, and we are trying to build our connection with Wheels and expand our network to reach more individuals so that we can serve the people, children back in India. We are currently feeding around 2.1 million kids every day, and we are looking forward to expand that, and that's one of the reasons we are here. Thank you.
Thank you, sir. Nice to meet you.
Nice to
and
meet
we are congratulate on our TV channel. Great success in future. Thank you very much.
Thank you.
We have here with Neha, who attended Wheels on the Foundation. So, Neha ji, tell about what's your role on the Wheels on the Foundation briefly for our audience.
Absolutely. Thank you so much, and thank you for asking the question. So I'm from Nova Foundation, and we partner with Wheels on initiatives related to girls' health and hygiene. Uh, with Wheels, we are trying to expand our reach in different villages in India. We are already in more than 600 locations in India where we provide sanitary pad machines and the pads to girls in 2 rupees only. And Wheels had been a great partner, and we have a common alignment on making this initiative that we call Sangini even better, and so it can reach to maximum girls. It can impact the maximum girls within rural India. And Wheels is doing a great job. I am from Madhya Pradesh, so this particular project is very close to my heart. Wheels had been a great partner and has shown a great dedication towards the health and education of rural kids. And I wish Wheels all the best. And Ratanji, I'm really humbled that Ratanji has invited me here and has always been supportive and has provided his guidance in the endeavors we pursue. Thank you.
Thank you, Nehaji, sharing your thoughts. I'm with Raj Shah, chairman of the Health Foundation for the Wheels on the Foundation. Tell about your role in the Wheels on Foundation, what you did so far, and what's your future plans.
Health is one of the 6 verticals of Wheels Global Foundation, which stands for water, healthcare, education, energy, livelihood, and sustainability. I am the chairman of the health care, and under my healthcare, we have 70 health council members. We leverage technology to solve a health-related problem for rural population in particular. We try to go where there is no healthcare facility in those villages. During COVID, we established 300 telemedicine centers in the villages where there were nothing, these villages in 7 states, and provided free care to 15,000 villagers, giving medical advice and appropriate treatment. Our goal is to have telemedicine centers which can provide healthcare delivery to villagers where there is nothing in 10,000 different sites. We'll be working with private and public partnership. We'll try to bring hospitals and clinics and the doctors to provide services. We will create a helper in the village who will be a telemedicine operator who will be creating a job, and there will be a small fee that villager will pay, which will sustain the program. And the way it is created, Wills Global gives donation one time to create a telemedicine site. It cost about $1,000 to bring the internet connected device, medical devices, software, and its training. All this thing is done free of charge to the for the telemedicine side, and subsequent operating cost is covered from a small fee of telemedicine consultation. We bring educational program using spoken tutorial. Classic example that we had today was a breastfeeding technique, which has helped to almost eliminate the malnutrition and undernutrition of newborn babies up to their first 6 months, because first 6 months babies are exclusively fed on by breastfeeding. And if there is no proper technique, if mothers are not educated about it, the weight gain is almost 18 to 20 grams a day, compared to with proper technique it goes up to 50 to 60 grams. So we literally eliminate this just by teaching them. We partner with Madhya Pradesh state government, and we got a generous grant from Wrist Foundation of $400,000. So we'll be taking to the statewide, and we are doing the similar program in Maharashtra. We are doing similar program in Goa. Will be Gujarat and other states as they come along. This is how we take a low cost, but we make a huge impact. We also will be working on mental health to bring integrated health for yoga and medication to help rural population to deal with anxiety, addictions, suicides, etc. We will be working on the health of the women menstrual hygiene by providing low-cost sanitary pads to schoolgirls with a distribution in the school using the automatic dispensers. We are working with IIT Kharagpur and other IIT Tirupati, IIT Bombay, to develop low-cost medical devices which will help us to diagnose patients in the village area. So there are so many things that Health Council will be doing. My goal, as I said, 10,000 sites. It'll cost us $10 million. I'm in to raise this money, and I know we'll do it with the support of everybody. Thank you very much for this opportunity to bring this message to you. Thank you.
Thank you, sir, sharing your thoughts and what you are doing. Good luck for your future help for the younger generation, whatever, everybody to help us, whatever their needs. Thank you very much.
you.
Thank you.